The rivalry between the ER and the ICU is insane. Hey, my name's Reese. I'm an EMS nurse who's seen the ER and the ICU, so I kind of get the gist of both worlds. Why is there this inherent hate relationship between the ER and the ICU? It's because we don't understand each other. Each person is doing their own thing, and they have never actually seen what the other side has to deal with, which is what leads to this inherent misunderstanding and almost a hatred between floors. The ER side of me is like, well, it's a never ending door. It's a revolving door. There's always patients coming in. There's always something to do. There's always something going on. And yeah, that 6 a.m. med is maybe not the most important thing I have to do on my list right now. So sometimes it gets missed, which sucks because I would really love as an ER nurse to be able to hit every single little detail and get it done, but it's just not realistic in our current climate. On the flip side, the ICU nurse has an incredibly difficult mental job going on. They have 20, 30, 40 times as much charting as us to do from the ER. When I used to be an ICU nurse, about half of my shift was spent just charting. The ICU also has a lot of intricacies that the ER does not have to do. Things like labeling lines or making sure that you're stocking your own stuff, which I never had to stock my own stuff in the ER, which was nice. If we start to break down and start understanding each other's roles instead of just bickering and infighting, we could spend more time focusing on the patients. Walking into every single conversation with a tiny bit of grace for the other person will really go a long way, especially in the grand scheme of things.